Can I do a Medicare Minute without politics on the new TrumpRx? Now it can impact seniors? Absolutely. Thank you for the wonderful question. This is AndSaul, probably a 4 or 5 minute Medicare Minute. Let's dive right on in. Okay, so before we get into the good, the bad, and the ugly, from my understanding, is that it? Is that a Clint Eastwood movie, Good, Bad, and Ugly? Anyways, let's talk about what it is. TrumpRx, it's a government portal. It's TrumpRx.gov. The goal is to help people find discounted cash prices that directs them literally to the manufacturer's channels or coupons. It's not like a doctor writing a prescription, and it's not a Part D plan. Essentially, it's a cash pay discount pathway for manufacturer participation in couponing that gives real cash price relief on certain high-profile brand drugs. Now, some of the early pricing we're seeing being advertised right now is meaningful, especially with GLP-1s, right? And for those who are uninsured or underinsured or paying cash for really expensive drugs. So to get back to the GLP-1, you go on the website right now, you see them as cheap as $149 a month and all the way up to $350 a month. For GLP-1s, stage 2s that we've seen for $400, $500, $600, $700 a month from other people. TrumpRx also gives transparency into cash options for prescription drugs. So you don't have to call 10 different pharmacies to find out who's going to give you the best deal. That's a win, right? As even not having to navigate with some tool online, that's a big win. And the goal is to increase competition pressure, right? If enough people outside of insurance channels turn to TrumpRx, they can pressure then other parts of the whole health insurance system to respond. We're talking plans, PBMs, pharmacies, and manufacturers, everybody. Now, for insured members on Medicare Part D, the savings may not translate quite as clearly for them because you can't combine the two. The catch is if you pay cash through a coupon channel, it's not going to count towards your deductible or your out-of-pocket tracking on Part D because you didn't run it through your Part D benefit. So you may save something today, but end up missing out in the long run because you would have hit your max out-of-pocket earlier. And remember, this is also only limited to certain participating drugs, and the terms can change at any point. It's not like all drugs for everyone is on there. It's a set of participating manufacturers and products, and then the list and terms say that they can change at any point. So TrumpRx is a help, but it's not like a universal Part D reform, right? Well, the other downfalls, the coupon economics, they shift the cost around, not necessarily eliminating them. So the discount program you're going to get here may lower a consumer's price, but it doesn't magically remove the cost of that drug from the system. Sometimes they're going to, they will shift a prescription around to a new channel so that the manufacturer can bypass those traditional negotiation pressures, but someone's going to end up paying in the end. And then the biggest problem is this is probably going to confuse a lot of seniors, right? Seniors may think that TrumpRx is Medicare drug coverage or that it replaces Part D. It's not. It's a cash pay route. And Medicare rules still apply for penalty timing, for credible coverage, and for plan design. It could weaken risk pools if they're widely adopted the wrong way. So think of this, as a bunch of healthier members start cash paying on TrumpRx outside of Part D for certain medications, and then sicker members who can't get their medications through TrumpRx have to get it through Part D. That's going to put a lot of pressure on Part D premiums and formularies, and that will cause adverse selection. And then long term, we've got legal issues that could come about or policy uncertainty. And once again, these drugs are participating today, but who's to say what's going to happen the next month, right? And then there's also a debate about how durable this is. What happens if the manufacturer participation changes? If legal pressure ramps up? Or what do you want, buddy? Or if future administration retools these things. So uncertainty matters, right? Because we're building decisions around things we don't know. Here's the nuance, though. All this is happening at the same time Medicare and the Inflation Reduction Act is coming online. So now we've got these two parallel lanes. We've got Medicare's negotiated pricing pathway over time that was set during the Biden administration. And then we've got TrumpRx, the direct-to-consumer cash benefit pathway. And they can coexist, but it's not the same tool. So my reasonable forecast then would be based on how these systems probably are going to behave. In the short term, TrumpRx, this should be helpful for cash pay patients and perhaps a limited set of high interest drugs. I would expect major marketing and high curiosity amongst the public. In the midterm, if this adoption grows, then Part D plans, PBMs, they will respond with tighter formulary strategy, more steering, and better point of sale pricing to keep people in the Part D lane. However, the long term, I don't know. The biggest determinant will be whether manufacturers keep this channel attractive and whether policy shift will expand or limit it. If participation drops, the impact of it drops. If participation expands, it becomes a permanent alternative lane. So TrumpRx isn't nothing, but it's also not everything. The truth is somewhere in the middle right now. So it can and it has lowered prices for some people. It will not, however, replace Part D, and it can create trade-offs if seniors use it without understanding the math. This is Teddy, and Teddy wants everyone to know that he says, hey. Say hey, Teddy. Hey.